Hi, everyone. Thank you for joining us today. We'll be starting very shortly. We're going to give people a little bit longer to join. We'll be back in just a moment. Good afternoon, everyone, and welcome to today's webinar on concussion management. My name is Tom Barsha. I'm a physical therapist and clinical director of Spears Midtown West 44th Street location. I'd like to welcome back those of you who have attended one of our webinars, as well as welcome those who are joining us for the first time. We appreciate you taking the time out of your busy day to learn with us. For those of you who do not know who we are, Spears is a private outpatient practice that has been around for over 20 years. We currently have 21 locations located all over the New York City area. We have successfully continued to offer in-person care throughout the COVID-19 pandemic, along with launching Spear Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of your own home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you feel most comfortable. If you are looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience, and we will make sure that we get you an appointment scheduled in a timely manner. We are excited to be here with you today to discuss concussion management. We will be defining what a concussion is, common signs and symptoms, treatment recommendations, and what roles PTs play in helping individuals return to physical activity. As you can see, we are coming to you live from our own homes, and although we do not anticipate any technical issues today, please be patient with us should any arise as we navigate working through this technology. Let's go over some housekeeping. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You will see a Q&A option pop up. This is where you will be able to put questions, and we will do our best to address as many of them as we can during the webinar. It is best to put questions in the Q&A. If you put questions in the chat feature, we will likely be unable to get to them during this webinar. For those of you who are watching through YouTube Live, we are monitoring the comments section there as well, so please feel free to put any of your questions there. Lastly, there will be times where multiple panelists are on screen. For the best viewing experience, please select Gallery View at the top right corner of your Zoom screen, so you'll be able to see multiple panelists at one time. So let's go over the goals for today. We're going to start by defining what a concussion is. From there, we'll discuss what the signs and symptoms are associated with concussion, discuss relevant statistics related to concussions in sports, review red flags of concussions and when, how to seek further medical help, discuss physical therapist's role in treatment of concussions. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone onto the screen now. Welcome, guys. We have Eli and Keith, who are physical therapists at our Park Slope location. At his previous workplace, Eli partnered with physicians at Boston's Children's Hospital to help treat high school and college-age individuals recovering from concussions. Welcome, Eli. Keith is a licensed athletic trainer and has significant experience identifying acute concussions on the field of play and helping educate and treat athletes during recovery. Welcome, Keith.
Thank you.
Lastly, we have Brett Warner, who is a physical therapist and assistant director of our Park Slope location in Brooklyn. He will be helping to answer questions in the Q&A feature today. Just a reminder, in order to see everyone, it's best to put your camera in gallery view. If you have done that, you should be able to see all four of us right now. All right, let's get started. Brett, Keith, and I are going to say goodbye for now, and we'll let Eli take it from here.
All right, thank you, Tom, for the intro, and thanks everybody for joining today. Again, my name is Eli Lamberson, and I'm a physical therapist at our Park Slope location in Brooklyn. So let's get into concussions. So what is a concussion? A concussion is a traumatic brain injury, often induced by some biomechanical forces. A concussion is not just a physical injury, but it's also a physiological injury. So when people suffer a concussion, they may have the physical trauma itself from the head injury, but they will often have trauma to heart rate, to blood pressure, to hearing, things like that as well. So we think of it as a physiological injury also. Within the first day or so, you're going to see and observe disorientation, confusion. You might see impaired balance within a day of the injury, as well as slower reaction time. In some people, their memory and learning is going to be impaired as well. I think it's important to explain that a loss of consciousness, while possible, is not at all required to be diagnosed with a concussion. However, it may indicate greater severity. So I want to go over three common causes of a concussion. Your most common is going to be from a direct impact injury, and this is what we think of when someone takes a hard hit in football or soccer or hockey, where there is a direct hit or blow to the head. These are your most common. The second most common injury is going to be from a motor vehicle accident, typically with a whiplash injury where your head is very quickly thrust forward and the brain within inside the skull actually moves and does what is called a counter-coup reaction. So where it can, because there is so much force from the injury, it can hit the front of the skull and then also back of the skull. And the third common injury and reason for a concussion would be a blast injury. The population we most often see this with is going to be with our military population. You might often see it as well with factory workers, coal miners, or individuals working in dangerous factories. And so next, we're going to go into some statistics about concussions. So as we mentioned before, motor vehicle injuries and blows to the head are very common. In addition to sports injuries, people can get them from falls as well, and those happen at about 35%. The risk of concussion is much, much greater in 18-year-olds than it is in your 13-year-old athletes. The reason likely for this is the physicality and greater body size, and therefore the greater force that happens as the older athletes mature. And then comparing boys and girls do tend to have a higher risk, and the research shows us that that risk is about 1.5 times greater than boys when playing comparable sports. Some of our theories as to why that is possibly due to lower strength in neck, upper back muscles to help to support the neck and lower body mass. Additionally, people who have had a concussion have a much, much higher risk of having one in the future. And the data has shown us that that risk is 3 to 6 times more likely, which is really big. So we want to make sure we're screening these individuals and diagnosing them correctly to prevent that future risk down the line. And lastly, while we've done a much, much, much better job in the medical community, particularly over the past decade, of identifying, doing proper screening, it goes way underreported. And we estimate that up to about 50% of youth concussions in the United States go unreported every year. So concussions can affect multiple systems throughout your body. And so I want to go through time today of breaking down concussions into various clinical subtypes. And then we're going to talk about each subtype, how they present, and how we as physical therapists will help identify them. So your first subtype is going to be vestibular and visual. Second is going to be more related to your mood or your anxiety. The third subtype we group as cognitive or fatigue. The fourth subtype can affect your autonomic nervous system. And then the fifth, which may be more common to people, is your musculoskeletal subtype. So thinking of neck and upper back pain. So let's dive deeper into our vestibular subtype. So first, the role of the vestibular system is really to provide our body and our head a sense of balance and information about where we are in space. So, all the time we have what are semicircular canals in our head, and they help to let us know what our head position is, sensing things going around us. They allow us to have good balance and good movement and posture. This can be affected when you get a concussion, and people that fit more in that vestibular or visual subtype might present with having difficulty with reading, difficulty taking notes, and most often you'll see them or hear them having difficulty walking in crowded environments. So going to the grocery store, being in a concert hall, or being in a bar or a restaurant, things where it's noisy, it's loudy, there's a lot of stimulus around them. This has a potential to set off their symptoms for individuals that fit more in this subtype. Additional symptoms you might see that are common for this are going to be headaches, fatigue, dizziness is very common. Sometimes, if severe enough, you can see vertigo, nausea, and then blurred vision and double vision. So our next subtype is our mood dysfunction subtype. This will usually present more acutely, but it can prolong over weeks and even months. A person in this subtype may present as more irritable. They may have symptoms of anxiety, symptoms of depression. You may notice yourself, or if it's a child, getting much more overwhelmed with schoolwork, overwhelmed with social interactions, just feeling down and not quite themselves. A result of this might be having difficulty with work performance, difficulty in school, keeping up with your homework. And all of these things, because your mood is affected, have the potential to exacerbate those physical symptoms of fatigue and headaches and nausea, dizziness. Our third subtype is cognitive dysfunction. So here we'll see often headaches, but the bigger things are people having difficulty focusing, difficulty remembering and concentrating, and brain fog. And brain fog is a strange term, but how I think it's easier to find is thinking someone like they're moving in slow motion, or almost as if you're drunk, where you just aren't able to react and focus as quickly as you're used to, or recall things as quickly as you're used to. And maybe that's forgetting numbers or addresses, or you're going into the other room and then you forget what you went in there for. And then also, presenting as poor school and work performance. So our autonomic nervous system dysfunction is present in most individuals following a concussion. So the role of your autonomic nervous system is very important, and that is to regulate your blood pressure, your heart rate, your sleep, and your hearing. So your basic functions that are happening all the time, but we don't really have a whole lot of conscious awareness of it. When there's dysfunction present, you can see individuals have difficulty with noise sensitivity. So, things like loud environments, concerts, car sounds or horns going off can really set off their symptoms. They may have difficulty being out in the sun due to having light sensitivity, or if they go into an environment with really bright fluorescent lights, that can set them off. So often when we get someone in the clinic, we'll take them into a private treatment room and dim the lights and do our evaluation there so that they aren't disturbed at all and we aren't setting off the symptoms just from being in a brightly lit area. Another common symptom will be exercise or activity intolerance. And when you see this will show up more often with differences in their blood pressure and heart rate response when either they're exercising or just day-to-day activities like walking, going up and down stairs, getting in and out of a chair, finding themselves really, really fatigued. And that's one of the bigger signs and symptoms of your autonomic nervous system dysfunction is that fatigue. And then lastly, we'll talk about our musculoskeletal subtype. So common symptoms of this, because of just the simple trauma to the head and neck, you're going to see symptoms of neck and upper back pain, soreness, stiffness, maybe decreased range of motion. In more severe cases, people may experience numbness, tingling into their arms and fingers. Additionally, symptoms that fit in the musculoskeletal subtype will be headaches that radiate from the back of the neck into the upper cervical spine. And in particular, those symptoms are worsened with certain head movements side to side or up and down, or certain postures. So potentially, if you have to sit and work at your desk for long periods, or more flexed postures looking over at your phone, that would fit more into our musculoskeletal subtype. So next, I'm going to switch things over to Keith, and he's going to talk more about signs and symptoms with you. Take it away, Keith.
Thank you, Eli. Thank you, everybody, for attending. As was mentioned before, my name is Keith Feind. I'm a physical therapist, also at Spear Park Slope location. I'm also a certified athletic trainer. So I'll just talk a little bit about what the CDC defines as signs and symptoms of concussion. So we'll go into what's reported, which either someone may tell you or what you might yourself tell someone versus what is observed, and that's what you're going to be able to see. As Eli was mentioning before, with approximately 50% of concussions not being diagnosed and going unreported, the observed is really also, if you're a parent, you have a child or a loved one, really important to focus on. So anything they're going to report to you is, headache, pressure, any sort of nausea, vomiting, balance problems, or dizziness, which you can also see in somebody. Any sort of light or noise sensitivity, especially if you're in a stadium, you're in an arena, like they can just be holding over their ears just because the sound's bothering them. Any blurred vision, and again, the confusion that Eli was mentioning, concentration, memory problems. You've probably heard before, seen in movies where someone's like, hey, who are you playing against? What's the score? These are all questions that are commonly asked on the field itself. And the observed things is they're unable to recall prior events that are happening right before or right after. They might not be able to recall the play. Somebody might get hit really hard, or you see this all the time with car accidents, like what happened? And they just don't remember. Going back into sports, unsure of the date, the time, the sport, their opponent, who you are, if it's someone they're familiar with, where they are, the day of the week, anything related to those questions. Similar to what brain fog was mentioning, you can see them answering these questions very slowly and very unsure. And if this is somebody who is a loved one of yours, you might be able to pick out this much earlier than a coach or an athletic trainer or somebody else. If your child gets hit in the head and you notice they're just a little different, they're a little off, some of these changes that are happening with them might be important to note. And then also you're seeing any sort of clumsy movements, kind of staggering when they're walking, just looking off balance. Again, they might not be able to tell you that that's going on, but a lot of times you can report it. And, this is important to note that there's about 30% of schools in the United States do not have certified athletic trainers on their sidelines. So as a parent, as a loved one, as a caregiver, being able to notice these signs and symptoms are incredibly important. And there's approximately about 1.8 million concussions annually in children. And as we mentioned before, about 50% are not even reported. So that can even be, 3.5 to 4 million. So here's the red flags. This is the, something went wrong. Things are getting worse. We need to kind of rush somebody to further medical care, whether it be an emergency room or a call to their physician. So a decreasing level of consciousness. we mentioned before that you don't need to lose consciousness to have a concussion. But if they look normal, and as I mentioned a little bit lower, there's a fluctuating level of consciousness. They're in and out. These are times to contact somebody else. Numbness in arms or legs. Again, Eli was mentioning, we see that with the whiplash as well. Pupils becoming unequal size. One will look really large, really small, or both will look really large. They don't react to light. There's something going on for sure there. Obviously, vomiting and seizures associated with any head injuries, always a good idea to get that looked at further. And any sort of slurred speech, inability to recognize common people or common places, and a worsening headache also. So prognosis, good news, 80-90% resolves within about 7 to 10 days. Persistent symptoms, and we'll go about this later, is in about 10 to 15% of cases. Your vestibular, your oculomotor, meaning more, your eye movement, your visual systems can last up to 4 weeks. And even if the person is asymptomatic, the brain still may be in a vulnerable period. There's a study out not that long ago talking about risk of ACL tears when a person is not fully recovered from a concussion, and it's about 1.6 times higher. And again, going back to the importance of noticing the concussion and being able to report it if you or your child is participating in sports or any sort of athletic event, your body's still very vulnerable at that point. And if we aren't fully recovered, we run the risk of a whole ton of other potential injuries from happening. But the good news is, as physical therapists, we can kind of help you to speed up that recovery. So, we'll talk more about that in a minute here. So who do we contact? This is always a great question to ask. If you're on the field, it's in a sporting event for you or your child, usually the athletic trainer, if there is one there, is going to be able to pick up on this. Anytime a kid gets hit in the head, and if the kid doesn't report it, the athletic trainer should be checking them out, doing an on-field evaluation, return to play testing. There's a whole ton of testing out, everything from stuff that can be done on tablets to visual, observations to questions. But if you don't have somebody there and you've noticed any of these things, contact your primary care physician, a neurologist if you have one, or the child's pediatrician right away. Physical therapists can also help into this, and we'll talk more about how we help with the return to play, getting back to normal. Sometimes your child might get hit and not notice something until the next morning. Middle of school, they might be noticing, like, wow, it's really tough for me to focus on what's going on in school. School nurses are there, very helpful. They're going to know how to diagnose this and refer down that further line. Also, we have psychiatrists, psychologists, and speech language pathologists for any sort of, mood disorders, social interaction difficulties, or for the speech language pathologist, any sort of, language or speech deficits, depending on what happened with the concussion. The bruising in the brain can affect a different part, which could affect these areas. But now I'm going to turn it back to Eli, and we're going to go a little bit more on the evaluation process of concussions.
All right. So our role as physical therapists in the initial evaluation, a little bit different than maybe other more common injuries we see in PT, is that we want to see you soon. We want to see you ideally within 72 hours after you've had that injury. And the initial evaluation is going to contain a variety of different things, and we're going to go through each thing. So 2 common tests that I'm going to do if I see you in the clinic after a concussion are going to be your Buffalo concussion treadmill test and your vestibular ocular motor screen. So the Buffalo treadmill test was designed to basically look at activity tolerance and exercise tolerance. So we were talking about our subtypes earlier. This is really going to kind of key into if you would fit into that autonomic nervous system dysfunction subtype. So what we're going to do at the beginning of that test is we're going to take your vital signs, so your heart rate and your blood pressure. We're also going to ask you questions about your symptoms. So are you experiencing any dizziness? Are you experiencing any nausea, any fatigue, or any brain fog? We're going to use a 0 to 10 scale for that, and your 0 being no symptoms, 10 being the absolute worst. And we're going to monitor those throughout the test. And how the test essentially works is every minute you're going to be walking on a treadmill, and we're going to be increasing the intensity each minute. Each minute, we'll be taking your blood pressure, taking your heart rate, and asking you about your symptoms. And our goal is to figure out what that threshold is when you begin to experience more symptoms. The results of this test allow us to get you on an aerobic exercise program, which is going to be really beneficial for your brain recovery, improving blood flow to the brain, and getting you back into the activities you love. In addition to that, we'll go through a musculoskeletal examination that's going to look at the strength in your arms, your legs, muscles around your neck and your head, looking at if you are experiencing any numbness, any tingling, how is the range of motion at the joints around your neck and your head, and really just screening that area to make sure there's nothing emergent, but then also finding the areas that might feel sore, tight, painful, so that we can provide exercises and also manual therapy to help improve that. And then your vestibular and balance testing. So that's going to be covered in our other second test, so our vestibular ocular motor screen. We're going to use that same 0 to 10 scale to rate your dizziness, fatigue, nausea, and brain fog. Throughout the test, we're going to be doing a variety of head and eye movements. And so this will be looking at that vestibular and visual subtype. So an example would be, which many of you may have done when going to the doctor, if they put a pen in front of your face and you have to move your head back and forth and look at the pen, or they move it back and forth and you have to follow it. So things like that we'll be looking at to track how well your eyes can track a movement while your head is still and while it is moving, and then using that to monitor symptoms and then provide some recommendations for exercises if you do fit into that vestibular subtype. The first session and maybe even the second session will be largely evaluation. Part of the reason of that is because we're seeing you so soon and you may be having symptoms, these things will take more time because we want to allow you to relax, allow your symptoms to calm down. So we might go through 2 sessions that are, largely evaluation. At the end of that first session, though, we want to really just talk and provide a lot of activity modifications and some return to school, play, and work recommendations. And so, how can our recommendations help you? So initially in the short term, and as Keith was talking about earlier, we're going to advise you to, stay away from screens, get good sleep, get some light aerobic activity. And then, the results from our aerobic and vestibular testing are really going to guide us in more specific recommendations for what that looks like. And then throughout your treatment, we're going to be redoing those tests to both measure progress, but then determine also if we're not making progress, if you need to see anybody else. And as Keith was discussing, we as physical therapists are just one member of the concussion management team. So we can also be, in constant communication with your primary care physician, with your neurologist, your speech language pathologist, so we can give you the best and most comprehensive care. I think our biggest role, however, is going to be education. We want to make you more aware of what the symptoms are, what things are, normal and to be expected given the circumstance, what the prognosis and expected recovery is like, but then also, what things might be more dangerous and might be things you want to be concerned about, and we can provide you with that information and get you to the right people. I'm going to bring Keith back on to talk more about acute management and what the first few days after a concussion are going to look like.
Thanks, Eli. So as Eli was mentioning before, initially, the first 0 to 3 days or when symptomatic, we're really going to just talk about just a little bit of active rest to start off with. So important thing is have a relatively consistent sleep schedule. Try to avoid like the midday naps. It's going to kind of throw your whole system off. Always important to make sure you're eating and drinking properly, plenty of water, plenty of good foods. Low stimulus activities, are going to be helpful. High stimulus activities have a possibility of really just making the concussion worse, making the symptoms worse. delaying that recovery to which you or your child want to get back into. We also talk about considering the temporary removal of school or work. And, there's been multiple studies showing that students should not be allowed to take tests when symptomatic for concussions, increased stress, lower test scores, increased anxiety because they're like, I can't concentrate on this. And now I feel additionally stressed onto this. Eli was mentioning before about, screen time. If it's affecting you or your child, even just looking at a cell phone, which, it's going to be pretty hard to tell your kid not to use their cell phone or not to play video games. If it's bothering them, it's an important thing to kind of just cool it down, let those symptoms resolve, is to not continuously be aggravating those areas. If you can't avoid crowded environments, being in a sporting event whether it be high school, college, professional, middle school, you can have bright lights, you can have a band playing in the background. If that, again, is symptomatic, it's a better idea to pull yourself and pull your child away from that. Important thing is really just pace yourself. Don't try to rush through this. Don't try to push through this. This isn't a no pain, no gain type thing. This is, this is your brain. I tell people all the time, you can still function with a broken leg. You can still function with a broken hand. If you really damage your brain, we got to pace ourselves to not make things worse here. We only have one brain. Then we'll go a little bit more into, like I mentioned before, about the active recovery. So in order to start really beginning the return, that's what everybody's going to talk about. When can I go back to playing sports? When can I go back to school? When can I go back to work? You need to be 24 to 48 hours free of any symptom-provoking activity before we can begin that process. And then we gradually build into it. We'll kind of go into the next slide as well, but we start off with being symptom-free, then some light, cardiovascular activity, keeping the heart rate still relatively low, whether it be, gentle biking, swimming gently, going out from there up to resistance training, non-contact drills, non-contact practice, full contact practice, and then, finally the competition. So our next slide here, we have a nice little graphic that kind of shows just kind of like what we could do for this. So in that first one, it says no activity, relative rest onto there. Are you symptom free for 24 hours? Okay, then we begin to the next step. If we're not symptom free, we cannot progress to the next step. So say we go to light activity and we mentioned, that's a brisk walk for 10, 15 minutes, a bike ride, anything like that. Are you symptom free? Okay, then the next day we can progress to the next step. If not, we have to go back to the previous step, be symptom free for 24 hours before we can progress. And as we mentioned before, 80 to 90% of concussions get better within about 10 to 14 days, which is why we test people through this. So if they're going and, they go through light activity, you check in with them that day, you check in them, 24 hours later. Oh yeah, that's fine. Okay, let's go to sport specific exercises. If it's not fine, like I said, we got to take a step back. Going to sport specific exercises, we can talk about, agility drills, a little bit of running, a little bit of not full on like sprinting, not full on catching passes, maybe shooting some free throws, maybe shooting some jump shots with nobody near you. Same idea. We're free for 24 hours. Cool. Let's go to the next set. Now we went to non-contact training drills. If you're in sports, you're thinking run some routes, run the bases, hit off a tee, anything that is not going to risk damage to the head. So we'd still, shy away from playing full on hockey. We'd still shy away from headers in soccer. We'd shy away from anything that could either, like Eli was talking about, prevent that direct impact of the head or that counter coup force into there. All that goes well. Cool. We progress to that last stage, which is a full contact practice, full normal practice, almost treating it like everything's fine, treating there's essentially nothing going on. And this is where the really important part to monitor is if there's symptoms at any time, whether it be before this, they actually start, during, or any time within 24 hours after, they have to go back again to the previous stage. But if they're symptom-free 24 hours after that, clear it with your athletic trainer, clear it with your physician, and we can get into getting back to what you want to do. And as physical therapists, this is a lot of fun. We can help you guys get through this and seeing, either yourself, your child getting back from having difficulty with walking because it was causing headaches, back onto what you guys love doing. But kind of what happens after it doesn't go for 2 weeks? So some people might have heard of, post-concussion syndrome, and this exists anywhere between 10 to 20% of cases. It can last for weeks, months, sometimes even years. And this is where, again, as PTs, we can really help on out. But a couple things to notice is that, if you have had a history of concussions, you do have a risk of, post-concussion syndrome with future concussions, which is why it's so important to have a good connection with your athletic trainer, with your primary care physician, with, if it's a child, the pediatrician, with having, any sort of medical provider, because, if there's a certain amount of concussions, they're going to tell you, and especially with multiple concussions, always tell people, make sure you're getting cleared by a neurologist to get into this return to play, because there's times where people are told to stop from, competitive sports, from contact sports, from high impact jobs because of, the risk of the damage to the brain. So what can we do? So we can help for these cases restore strength and muscular endurance, similar to what Eli was talking about for, reduce strength in the postural muscles and neck muscles. We can improve the balance of the feelings of dizziness, the headaches, the muscle tension, and like we talked about before, help return to exercise, sports, the things you guys love doing. And we can kind of help to guide and shape that, again, based on what subtype you're in, what your symptoms are, and what, the ultimate goal there is to get you back into doing what we love. All right, with that being said, we'll invite Tom back on screen and get to some of your questions and answers.
Awesome job, guys. Definitely learned a lot there. Thought that was a great summary. I think I may be echoing a little bit. Let's see. All right, I think we're better. All right, so we have a few questions here. Let me start with the first one. So in the way beginning of the presentation, you mentioned some, symptoms as far as what a concussion, responds. And then we had a question at the beginning: is it normal for those sensitivities to last for years after the concussion?
I can answer this one. That would fall more into that post-concussion syndrome, where there's more like the long hauler concussion syndromes. As we mentioned a couple slides ago, that can exist in about 10 to 20% of concussion symptoms, but those longer term ones are relatively more rare.
Great, thanks. All right, another question here. Are eye fatigue and light sensitivity considered active symptoms after a day of work on a laptop? Does that indicate that someone's not ready to return to volleyball?
I think, with visual symptoms, it's important also to, make sure within the past year or several months, you have seen an ophthalmologist and have, eye symptoms checked. It is possible that those are active symptoms of a concussion. I would want to know how long ago was the concussion, a little more specifics about, your particular setup at home, as well as if there are other stressors that will cause those symptoms. But it is certainly possible.
Great, thanks. All right, this is a good question. Covering a lot of youth football as an athletic trainer, I used to get this one a lot. Is it okay to sleep or allow my child to sleep after experiencing a concussion?
I'll take this one. Yes, absolutely. I think a old myth and common misconception, and this was definitely advice that was given for a long time, but as we've researched more and learned more, we do want you to sleep. It is okay, it is safe, it is encouraged to sleep. The advice that we give is we want to get you on a normal sleep-wake cycle. So ideally sleeping 7 to 9 hours a night, minimizing screens, at least 60 minutes, preferably 90 minutes before bedtime and upon waking up in the morning. This will allow your body to get into a good circadian rhythm to help really reap the benefits of a good restful night's sleep and speed that recovery up.
Great, thanks, Eli. And then another very common one that we get is after a concussion, is it okay to use your cell phone or be on your computer, especially everyone working from home after getting a concussion?
I can answer that. I talked about it a little bit briefly. Symptom-free, it is okay to use it if there are periods where you'll see this a lot, especially with an acute concussion, just looking at that screen, whether it be a cell phone, whether it be a computer. If you're having any symptoms with it, that's when to back off. If they're not having symptoms, we should still limit it. We shouldn't be going, okay, sit at your phone, sit at your computer, sit in front of your TV for, the next 8 hours, because that period of rest in the beginning is going to be important. But symptom-free, it's okay to use in small doses.
Yeah, and I think, like you said, erring on the side of caution, particularly in that first, 48 to 72 hour window, is important.
Great, thanks guys. And then what about imaging? So do you think that you need imaging to appropriately diagnose a concussion?
I would suggest talking to your pediatrician, neurologist, or primary care physician. Those would be the ones who would suggest if imaging is needed. I've worked with multiple athletes who have had multiple concussions, and sometimes their pediatrician or their neurologist or a referral says, yeah, we should get some imaging into there, but that would be a better question for a neurologist themselves.
Great, thanks. And then this is a little bit more of like a personal question, but fell about a month ago or 2 months ago, went to the ER, got a CAT scan, shows no bleed, was told to see a neurologist, was not to see a neurologist. Now the primary care is recommending PT after about 2 months. How helpful could that be for the patient?
I think that could be really helpful. I think, as we talked about earlier about the evaluation, we're going to take you through some testing. We're going to sit and talk with you for a little while to, get a sense of what you've been experiencing. What are the symptoms you're having? What are the common triggers that set them off? What's the severity like? And then take you through some tests to kind of get a sense of what subtype and subcategory you fit in, and therefore provide recommendations for that.
Great, thanks, Eli. We have a viewer who's asking, 71 years old, it took 9 weeks to get better. Is that normal for seniors? And I guess to elaborate on that further, is there different healing depending on, youth, kind of middle age, and then geriatric?
Generally speaking, yes. To my knowledge, there's not a ton of research on the varied healing times after a concussion, but what we know about just, general tissue healing times, we heal slower as we age. And I think, the brain is likely no different than that. So you could probably expect that there might be a little bit of a normal delay in healing time if you are 71 years old compared to if you're 17 years old.
Great, thanks. And this is a typical question. I think Keith hit on it a little bit, but is there a certain magic number where you feel like, I had X amount of concussions, can I still play, contact versus non-contact sports?
Really, in every time I've seen that has been determined by the neurologist, by the medical team. It's usually a collaborative effort between, the person who has had multiple concussions, family members, a neurologist, a primary care physician, if it's a child, a pediatrician, but the athletic trainer, the physical therapist, the school nurse, they're not going to be the ones to make that decision. That's going to come directly from the neurologists themselves.
Yeah, to follow up on that, I mean, there's no real threshold or number because severity of the concussion, may dictate that. And then, also it goes into, if it were me, I think we have to consider also the kind of psychosocial factors of it too. What are the risks and rewards associated in getting back to that sport or that activity that you want to do? Is it something that you're making a living off of? Okay, you might be more willing to take a greater risk. And so, that's a very personal individual discussion, as well as the more, physical and imaging side of things.
Great. And then another question, kind of like return to sport with a concussion. Is it safe to run if you're still experiencing symptoms of a concussion?
If you're running and you're continuing to experience concussions with a symptom, we'd recommend not to continue running because something's still going on in there. The brain's not fully healed, and that increased stress and that increased nature is flaring things up and making things worse. So I had that one graph that kind of showed that, step method, that's something where you're feeling symptoms. I would stop, and until we start feeling symptom-free for 24 hours, would I try to go back onto that next step of running.
Thanks, guys. And then, if anyone else has any more questions, feel free to put them in the Q&A. I think, a nice little wrap up of what Keith and Eli are bringing up is the importance of this interdisciplinary care when it comes to the treatment of concussions. A great thing about, Spear, we have great relationships with a lot of top doctors in the city, and we definitely want to make sure that we're always, collaborating in the care. So, we'll typically follow their guidelines and then help people actually get back to them their activity. If you have any more, specific questions, you could definitely reach out to the guys as well. But with no other questions, we'll wrap it up. We hope that you guys enjoyed today's talk and that you found it valuable. We hope that you learn more about concussions and some treatment methods and lifestyle modifications to manage and improve your symptoms. If we didn't get to your questions, we will do our best to reach out to you directly afterward, especially to some of you who, in the Q&A had more specific questions that we feel like would be better answered by directly reaching out to either Eli or Keith. As a reminder, your presenters for today were Eli Lamberson. Thanks, Eli. And Keith Feind. Great job, guys. Feel free to jot down their contact info so you can reach out to them directly with any questions or to schedule an appointment. Our Q&A moderator was Brett Warner. He's the Assistant Director of the Park Slope location. And I'm Tom Barsha, Clinical Director of our Midtown West 44th Street office. Feel free to reach out to us as well if we can, and we'd be happy to help answer questions in any way. At Spear, we treat an array of conditions from head to toe. And as a reminder, we're open for in-person visits as well as for telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any of us individually, as we will personally coordinate you being set up with one of our team members for an evaluation. Lastly, at Spear, we will be continuing to host webinars through 2021, covering a variety of topics. We look forward to seeing you there. Please follow us on social media and/or check your inboxes to learn more about upcoming events. Thank you all very much for spending time with us today. We hope that you enjoyed today's webinar and wish you all the best.